and welcome to the absolute first premiere of Pragmatic Psychology. My name is Susanna Mittermaier, and I'm very excited to launch this video series that's going to be created here on the Pragmatic Psychology channel about all kinds of topics. So today we're going to talk about going beyond mental illness, and today especially is choosing beyond bipolar. So let me just, before we dig into this, give you a little bit of a background. So I'm started out as a clinical psychologist in mental health, or it's called psychiatry in Europe. So I think it's called mental health in the States and other countries. And so I would do psychotherapy with people, counseling, psychology tests, testing intelligence, checking if people have ADHD, autism, all kinds of diagnoses, depression and anxiety. And so what I found was that so much of that perspective that I'd studied and started to work with was all about the wrongness of people and all about finding diagnosis, like boxing people into different diagnosed boxes, as though that was necessary to create change. So I came to a point where I noticed that there's so much more possible beyond the traditional paradigm. And I started to go on a search, and I found a totally different modality called access consciousness. I did some classes, and I started to apply what I learned there in my field, which is psychology and psychotherapy. And now I'm creating a different paradigm with psychology and therapy called pragmatic psychology. So it's all about letting go of the dramatics of everything that doesn't work and how hard you have to work to get over your problems, all those years of therapy, and going to the pragmatics of what truly works for you. So, and I know like mental illness and all the diagnoses, especially bipolar, as we're going to talk about today, are all those hopeless, it seems like one of those, the most hopeless diagnoses, especially bipolar. You're supposed to have this your whole life, and it's supposed to be unchangeable and ruling your whole life. So I have worked with people in the clinic where we actually could change their bipolar. And today, we have the honors of talking with an amazing woman called Lauren Pauly, who has personal experience about bipolar. And we're going to find talk about new perspectives and tools, how you can change what seems so extremely impossible to change, and how that is possible. Lauren, welcome. I'm grateful you're here, and I'm grateful you're willing to talk about something that so many people do not want to talk about because there's so many judgments and stigmas around it. So welcome, Lauren. Thank you for being here.
Thank you, Susanna, for having me. I'm excited to talk about this.
Cool. So what's your take on it? Tell us a little bit about you and in regards to bipolar.
Okay, so I was diagnosed with bipolar when I was 14 years old. Quite a young age. And when I'm talking, am I popping up, Susanna?
Yes, you are.
Yes, cool. Okay, just making sure. Technical issues. Yeah. So I was diagnosed when I was 14 after trying to commit suicide a couple times. And I had kind of hidden all of the issues I was facing quite well from my family, my friends. No one really knew that anything was going on with me until my grades at school started to slip. And so when that started happening, my parents went and actually searched my bedroom and found my suicide letter. And that was kind of what catalyzed going to the psychologist, the psychiatrist. And it was interesting because going to the psychiatrist for the first time, it was a conversation of, yes, what I was experiencing through the ups and the downs that I was hiding, through what was going on in my awareness, but also as soon as they heard that my aunt was bipolar.
Yeah.
It was like there was this little switch that went off in the doctor's head that I saw, and it was kind of like, oh, there's something. And all of a sudden I started getting very pointed questions and being very aware of where he was going and just aware in general of where people were. I was able to kind of follow the trails he was leading. For a 14-year-old, that kind of seemed like a smarter idea. And that actually led me to getting this diagnosis.
And what you say there is brilliant. So this is what, coming from the inside, having worked in psychiatry and mental health, this is what I've seen so many times. It's like you have a patient coming and the doctor is like many times overwhelmed by all the information. They only have a short amount of time to find out what's going on, why is it the problem, and what are we going to do about it. So the systems in many countries is very pressed time-wise. And so it's many times the doctor goes, okay, so what do I do with this? And the first thing is, okay, so what has been going on in your family before that? And they use this as an information to find out what's going on with you. Mm-hmm. Now, the thing is that many times it's not what's going on with you. People try to explain their problems and their diagnosis based on what their family has gone through. So we try to explain, like look through the filter of what has been in regards to our families. So we say someone in our family has depression. Oh, I have its tendency to be depressed as well. Or, the bipolar part. So this is where this is the filter, the glasses that most professionals look through. What do you call that in English? The heritage or?
Yeah, the heritage or the it's a hereditary diagnosis. So that's the thing. It's right. Supposed to be, it's carried through the genes. So as soon as they heard that, it was kind of like a nail in the head kind of thing. And I could see every other window in his mind closed, like, oh, that's what we're looking at. And if you're dealing with someone like me who's very psychic and very aware, that was a lot of the wrongness that I was going through, which is actually a huge capacity. To a 14-year-old who doesn't have the tools, it feels like you're going insane. And then you start interacting with a doctor, you start reading his mind, and these little windows open, and all of a sudden you start getting led down this path. And by the time I had the diagnosis, then researched it later, it was like, oh shit, it's a little too late now,
You say a couple of things that are so amazing, and I've met so many people who have something similar. So number one, it's like the doctor asks them about their family, and then based on that information, they come to conclusion about this has to be the case with you too, which it many times doesn't, because you are not your parents. You are different. You're your own being. Even if you grew up with them, even if they have had it, doesn't mean anything. So this is the thing where people stop asking questions. They go to the conclusion that because somebody else in your family had it, you have to have it too. And then, as you said so brilliantly, yes, then you go down the trail of, you got that label and now it's yours. Now
you're stuck with it forever.
Now you're stuck with it, and it's in your journal, so every doctor would read it, and they look through the same filters and they stop asking questions. So this is the detrimental part of coming to conclusion. It kills any possibility of actually being, knowing, perceiving, and receiving what else is possible and what truly is going on with you. So what is it? You said you were using tools and perspectives and different perspectives than traditional ways of looking at it. And you mentioned awareness, and you mentioned that you picked up what the doctor had in his head. You could sense, oh, he looks at me, thinks that I'm crazy, I'm insane, I have bipolar. So you pick up his thoughts, you know what's going on, and then you make it yours. So can you tell us more about that dynamic? And I think many people have something similar going on.
I think the people are doing it and you don't even realize you're doing it. Like right now I'm writing a book about my experience, and that's where, through the knowledge that I gained through Access Consciousness and stepping more into my capacities, that's where I'm really kind of going, oh, that's what that was. But to a 14-year-old, I'm just very aware of energies. I pick up a lot on other people, and I'm extremely fast. Yes. So when you kind of pair all those things together, you do get this up and down, left and right. And for me, it was always play. And then it started getting more and more extreme, and I started noticing other people reacting to my ups, my downs, my playing with energies. And that's kind of where I went, oh, wait a second, I'm different and I might not be okay. And so I started hiding it and kind of trying to lock it down while trying to figure out where I fit into the world, which for me has always been a challenge, because come to find out I don't have to fit into the world. I can create one of my own. And that was something that, being 14, that you're not taught that. You have to fit in. Yes. But that's where the fear really started to come in when I did go to the psychologist, and I started reading not only his mind of following that trail for the diagnosis, but also having them constantly tell me it's biological, you're going to have it forever, If you have children, you're going to pass it on to them. You always need medication. Even with medication, you're still going to cycle. You still may go off the deep end. You can't handle stress. There are all these things that are just layered very, very subtly in conversation, and you just start picking up on these like, oh, that's a wrongness that I'm stuck with. That thing over here. And it was fascinating. I remember being 14, sitting on the psychiatrist's sofa, and him saying all this stuff to me and going like, who the fuck would ever want to marry me? Who would ever choose to have me in their life if I'm going to pass it on to my kids, if the shoe can drop at any moment and I'm just kind of inherently messed up? And to put that on a 14-year-old is just, wow. Like, what else is possible beyond that?
So that's brilliant what you said. It's so when you hear people, and they're called experts, especially doctors, psychologists, therapists, we're so taught and so entrained to make whatever these people say real and cut off our own knowing. So there's a person saying all these things to you. What do? You just buy it as real and cut off your own knowing what's actually true for you. And so many people do that. So the invitation here is whoever is saying whatever they're saying, don't make that real. So we have a tool here that I'd like to introduce to all of you listening. It's called What's Heavy is a Lie, and What's True for You Will Make You Feel Lighter. So, for example, you're having an expert saying, oh, you're going to have these things, these ups and downs going on, and you never know what's going to occur. You're unpredictable. It's going to be hard to deal with you. You need medicine. It's not going to be changeable. So get the energy of that. Is that heavy or light? It's extremely heavy. It's like, yeah. So when something has that energy, it's a lie. It's not real. And usually people go, but it's an expert. He or she has studied so many years. They know. No, nobody knows better than you. If you use this tool, you're going to find out that most of the things you hear are actually lies. Like all the conclusions people make real, everything that's not possible, everything that should not be changeable. So then you go, oh, wow, that's a lie. What makes me actually feel lighter? What do I know? So this is where you start accessing what you know rather than going down the trail of somebody else's point of view, whether it's a diagnosis or any kind of conclusion, right?
And then it's never too late. I mean, that's the thing. I carried this diagnosis for 16 years. I went from being on 14 medications a day, 14, and trailed all that. I've been off medication now for 5 years, perfectly fine. And so, being 16 years into the diagnosis, that's when it really started to get heavy in my own world. And I started noticing I was kind of tracing down on medication throughout over the years with certain doctors. And then sometimes I'd forget to take the medicine because my body didn't want it. So, and I wasn't cycling. I wasn't having any issues. So, it was interesting. I went to a dermatologist in my late 20s, and he looked at my past medical history, of course. So he puts on his little filter. Oh, you're bipolar. And we had just had this conversation about me finishing graduate school and working at Emory University, which is a very intense and one of the best hospitals in the US. And he just said, this is very unusual. Most people who have that diagnosis would never have that level of education, never be able to hold down a steady job. And those are the kind of things where when people were saying that of like, maybe this isn't me, or maybe this doesn't fit. And that's what really started putting the question energy in my mind. But that's after 16 years of being medicated and going to, God knows how many psychiatrists. I've lost count at this point. It's like 10 or 11, So it's fascinating that, like, that's the big thing is a lot of people like, oh yeah, well, if you're first getting diagnosed, ask questions. Well, what if the diagnosis you've been carrying all these years actually doesn't fit you?
And that's so many times. And this is the necessity of trying to find an answer that most experts feel is stress and depressed. They sit there and think, oh, I have to find out what's wrong with that person. And I know in Sweden, when you meet a patient, the system is set up that way. So when you are a psychologist or a doctor and the patient comes in and just has one conversation with you, you have to, that's the rule, that's the law, you have to give them a diagnosis. They can't leave. You cannot just not give them any diagnosis. And this is such a press and stress from many experts to label people when there's actually no label. So I said many times as a psychologist, clinical psychologist, And I'm like, this person doesn't have a label. There's absolutely nothing that fits this person, but I have to, from law, because it's my job, to give them something, you know?
Mm-hmm.
So this is kind of like this side. And then there's also this part where people, the experts, think that is their job, to give people an answer, give them a reason why their life doesn't work. And one of
And
the
most people are
reasons
looking
is
for
the
that
diagnosis.
too.
They're looking for it. They love their diet. Tell me what's wrong with me. Do I have ADHD? Do I have depression? Oh, now I know what's wrong with me.
And for
now
me, that's kind of what took over, was like, I'm going from play, now I'm scared. Oh, look, you have an answer and you have pills that are going to make me all better.
Yes.
And especially coming, like, I was young, I was 14 at the time. My parents they had no idea what to do. Their solution was to take me to the best doctors they could find, which, what else would you do for your children?
Yes.
So I went to expert after expert, and that just kind of dug in the hole deeper and deeper.
Yes.
But that was the shift, was going from play to fear, and then, oh, something's really wrong, fix it for me.
Yes, fix it for me, exactly. And you go into the patient role, into the victim role. Oh, I'm the sick one, so you need to fix me. So you give away all your power of change to somebody else. Yeah. So now I'm curious, and I'm sure many, many, many people who are listening are curious as well. So can you give us one tool or one thing that you use that allow you to shift and change all these years of diagnosis, all these years of medication and wrongness and answers and conclusions? Can you share something so the listeners get a glimpse of what is that different perspective that we're inviting people to?
Yeah, it's like, I love what they say with access consciousness of, what if every wrongness is actually a strongness of you?
Yes.
And that was the huge thing for me, is actually being so aware, being so psychic, and being so aware of the energetics of the world, which most people don't speak to. You're never validated for that. You're never acknowledged, and a lot of times you're made wrong if, like, you're having a conversation with somebody and there's this undercurrent you sense. It's not spoken to, it doesn't match what's going on in reality, but there's these undercurrents, which for me always felt massive. They were blinding so much that I would get frozen a lot with them. Yeah. But because no one else was interacting with it or even acknowledging it, I thought I was crazy. So a lot of it is like, okay, well, if that wasn't wrong, that I was actually aware of all this stuff, if just because other people weren't speaking to it didn't mean it actually wasn't true for me, what else is possible here? And I just started playing with that. And that was that, and like the judgment piece, like coming out of judgment for me, even after being diagnosed, the 16 years of medication, even getting off medication, having the diagnosis overturned eventually, the shame and the social stigma was massive. It was still something that I needed to hide. And I got off medication before I found access consciousness. I did that through yoga, meditation, diet, very, very stringent lifestyle to try to like manage myself. I still wasn't living, and I was still shrouded in shame and the need to hide everything. So that's what the access consciousness tools really gave me, was coming out of judgment, like, interesting point of view. This was given to me. Mm-hmm. Coming more into the allowance of that actually shifted a lot. So it's like, you can speak up. You don't have to get stuck in the social stigma. And what if actually not even having to speak it in a public view like I am, but just having that in of yourself, like, there's nothing really wrong with me.
And that part, so that I want to stress, it's like the extreme wrongness. So when you get a diagnosis, you go, okay, now I got a label. Now I got a certification for being insane. And then you start create that as your personality, as your role in the world, to always be the victim, the wrong one. And it's like Lauren said before, it's like you start down that trail of wrongness and create more evidence every day. That was insane as well. Well, yes, of course, because I have this and this diagnosis. So it just adds on. It becomes this big, big, big pile of wrongness. And I love when you say, where you shifted that perspective for you, because it's really like our good friend Dr. Dane here says, your point of view creates your reality. Mm-hmm. If you have the point of view, you're the victim, the wrong one, the insane one, guess what you're creating as your reality? Mm-hmm. So when you shift that perspective and go, oh, wait a second, so all these things that these people have said about me, including the experts, especially the experts, that I have bipolar.
Expert.
Yeah, exactly. Is that true, or what is actually going on? So you start to go from conclusion and answer and judgment to the question of, what is it? What do I do with it? Can I change it? And if yes, how can I change it? 4 brilliant, amazing questions that would change anything in your life. What is it? What do I do with it? Can I change it? And if yes, how can I change it? And Lauren said, what the question, what is it, would be, oh, I'm different. I have a lot of energy in my body. I love to play. I am extremely aware of what's going on in people's worlds. And when I don't acknowledge what's going on in people's worlds, when I don't acknowledge that awareness, I make it mine. And this is where I think I'm going insane. So lots of insanity is where people don't acknowledge what they're actually picking up in other people's worlds. Pick up their thoughts, feelings, and emotions.
Being able to play with freedom without like, oh, if someone's reacting to me or looks at me strangely, doesn't mean I have to stop or turn myself down.
Yep.
You know, actually being able to have that perspective in of yourself and just going from there, it's a totally different way to be.
There you go. Because it's like this, it's when I wrote my book, it's Pragmatic Psychology, practical tools for being crazy happy. It's like really this crazy happy, because we all know when you're being that intense and you have a lot of play energy, there's a certain level when people go, okay, now you're either stupid or you're on drugs. There's like this level you can go to. There's this amount of happiness and joy people can receive. If you're going over that, no, that's insane.
To me, that was like the biggest like bastardization of my being, was this thing of like, if someone has a depression diagnosis, then a lot of times what I've noticed with people is that they don't ever let people see them get too sad. For me, because I had both extremes diagnosed, I could never be too sad. I could also never be too happy. I couldn't be too angry. I couldn't be too much in either direction. So I learned just behaviorally to keep myself very even. And anytime I started to play on one or the other and got an eyebrow raise, I shut myself down. And so it was really paralyzing. Like, it wasn't even that I couldn't be sad and allow myself to just experience that, but even the happiness and the joy started to really get shut down in my reality. And that to me was more of an abuse of me than anything, because that's who I naturally be. Yeah. And there's nothing wrong with that.
Yeah. And that's so interesting. And that must have taken a lot of energy also against your body. To cut off, like, okay, I can't be too happy, I can't be too sad, I have to be something in the middle, but still like go up and down. And the interesting part is that, I mean, if we look at the world we live in, everything is about up and down. It's like, oh, it's do you have a good day or do you have a bad day? Do you like this person? Do you not like this person? Is it hot? Is it cold? So polarity, plus and minus, good and bad, right and wrong, is this the reality we live in? So bipolar is like the play out of that world that we live in. And that's what I found so many times when I've been working with patients who had, I don't like calling patients, I usually call them clients, but in psychiatry you call them patients. It's like this play out of this world, and they just, and they realized, oh my God, I'm just playing this reality. I'm not being myself. I'm just pretending to be everybody else. I'm pretending to be like this reality, this plus and minus, up and down, back and forth, rather than being me. And then we used like the different processes and perspectives for the person to get a better sense of themselves, rather than seeing as it the only choice to just lose themselves in other people's worlds. Because that's what many people do. Many people just lose themselves in other people's worlds, because we've not been taught, like, who in this world, not many people have been taught to have that sense of themselves, to access that sense of themselves. So that's what I love about people's, go.
And to allow you to be like an ever-changing being. And I think that's where I always went crazy. It was like, okay, well, look at everyone around me. They're very stable. They're the same all the time. So I have to be that. Otherwise, I'm nuts, because I'm this and I'm that and I'm this thing over here and I'm having fun and playing with it. And that was the huge thing. It's like I was using so much energy to lock myself down, not only out of the sadness or the happiness, those extremes, but also to try to find some sort of very defined sense of self to live by. And for me, it always felt like the world was like a stage, And everyone had a script. Everyone had a role. They knew what was going on, and I was thrust out mid-performance. And
Okay, I don't know if I froze or you froze. Are you still here? Yeah. Okay, now it's good. Now we're back.
Okay. Yeah, but
instead of
actually getting stuck in that like role of like, no, to actually be in the world, you have to find one thing, and you're that one thing all the time. But to have a sense of yourself, and also allow that sense of self to be able to shift and change, and the fluidity that's actually possible.
That.
Yeah, totally different.
And that's so cool, because we all taught, so make up your mind. What do you want to do when you grow up? You know, what's your point of view? Do you like this? Do you not like this? It's like we're taught to find a stability. We're taught to find the stability points in our lives. And most of us seekers, we don't have stability points. We're like, I like this. Oh, I'm over it. Now I like this. Oh, now I'm over this. Oh, now I like this. But this is so wrong. And it's like, oh no, make up your mind, young lady. This is what we've been taught so often, rather than, oh no, you can change your mind every moment. What's wrong with that? Nothing. It's that flexibility that you can train since you are a little kid, or start training it now. It's like when you work out, you want to be flexible in your muscles. You want to be flexible in your being, to give yourself permission to change your point of view at any moment.
Yeah, and just because you're like that doesn't mean you don't know yourself.
No, because you actually know yourself better if you allow yourself to be that. You actually get to know, oh, I'm not just one thing. I have many toolboxes. I have many tools in my toolbox. I have many possibilities of what I would like to create myself in the moment. And then there's so much more joy in our worlds when we allow ourselves to. That's actually when we're more being ourselves than this thing that we've been taught. What's it called? Self-esteem. It's like it's so much tied into this self-esteem. You have to know who you are. I mean, the energy of that is just like, who knows who we are? I mean, who has a really like great sense of who they are in a way that they can describe it? Nobody. And why should you?
And from what you were saying before too, that's just a conclusion. There's no question in that. And the ability to actually shift and change and grow, that's the question, and that's the play.
Yes,
it's
the play.
Totally different. Yeah.
Yes. So this is an invitation for all of you guys listening, from Lauren and I, to let go of all the stability points, all the points of view that you have to be somebody and have to know who you are, and make up your mind on what you would like to be and like to do, and just create yourself in the moment. And, you know, even if you have days where you're happy and some days where you're sad, what if that is not a wrongness either? You can just go there, explore it, see what else is possible, and start to ask questions, you know? So when you're sad, you could ask, okay, so how many sad people around me am I picking up? When you're going manic and you have, this manic would be it's a joy that's not really joy. It's this force. You put a force on yourself to be joyful, or how would you describe that?
I would describe it a lot of like you said, force, a lot of energy that you get diminished very quickly. And for me, it always felt like pushing out or projection.
Yeah.
More of this kind of energy than just the settling back into yourself.
Yeah.
And actually being there and playing with the energy, but not having to like force or project out with it.
Yes.
Yeah.
Yes. So this is where you can ask yourself, like, either you are in the up part or the lower part, which many people just are naturally. Like, you have this moment of, oh, now I'm happy and now I'm sad. I'm happy, I'm sad. Like going back and forth almost like every minute or something. If you like just watch yourself, you go, oh, now I'm happy, now I'm sad. Or I'm waking up in the morning, now I'm happy. It's like this back and forth. And you can ask yourself, so who am I being?
And
who does this belong to?
And if you're very aware, you might notice that. And that's what flipped the doctors out with me, is they termed me a rapid cycler, which means that you shift constantly, very, very quick. And most people with traditional bipolar, they have like months of up high, then months of down low. And it was because of my awareness of energy and how quickly I was shifting, changing, and picking up on things. That's what won me the rapid cycling diagnosis because it was moving so fast.
And many people have that. It's just like in your day-to-day life. If you go outside, you go, oh, I feel so happy. And then you go into a shop, for example, and go, oh my God, I'm so tired, I'm so sad. And then you call it your own feelings rather than, where am I? Oh, I'm surrounded by sad people. Might it be that I actually pick up other people's worlds and buying them as mine? So just that perspective lightens up a lot of things. And there's so many tools that there are, so many tools and perspectives that can shift and change bipolar, that both Lauren and I have found in our work with ourselves and other people. And so there's so much more to this. This is just a little teaser, a little taster of what's possible, giving you the invitation, the energy of that there is a different possibility. There is a choice available in all of this that's many times denied. Because
and it's never too late, and I think that's where I went after 16 years and just so much, and taking to another specialist who all he did was confirm and dig deeper. So it's never too late. And I just say, like, from dealing with psychiatrists for years and years, if you're with somebody and you're asking them questions and they shut you down immediately, find somebody else. If you're with any expert who is not allowing you to ask questions, doesn't take your perspective into consideration, find somebody else. And really trust your knowing. Like, that's what I found. One psychiatrist, she was very light to work with. And after a year or two of working together, on my 30th birthday, that was my gift to myself. I said, you know what? I don't think this diagnosis fits. Not only do I want to get off medication and try that and see how I do, but I don't really think this diagnosis fits me anymore. And she was willing to work with me. So if you're with somebody and you actually start talking about a different perspective and they shut you down, there's tons of other doctors out there. Ask a question and go and explore something else. Trust yourself. Don't trust
I love that. Thank you so much for this. And it's really when you talk with someone and your world opens up, this is the person you want to talk to.
Yeah.
If you go, oh, I feel so much worse, this is not the person you want to talk to. So you've got choice. Don't forget that. Thank you so much, Lauren. So if people want to find out more about what you know, where can they find you?
You can find me on laurenpolly.com. That's my website. And I am currently writing a book, my memoir, about my experience and kind of going through kind of the capacities, how they were bastardized, my trip through the Western medical system and the medication, and then also tools and techniques that I use to meet the same energies as an adult and actually be able to play with that and not make myself wrong for it. So I'm hoping just to really spark the interest and spark the question in people of, maybe I don't have to live like this. Maybe there is a different possibility. And it's never too late to explore that.
Cool. Thank you so much.
Probably later this year will be out.
Awesome. That is so cool. What a gift to the world. So I'm so happy. So this was the first video on this channel of Pragmatic Psychology. I'm so grateful to bring this out into the world. If you want to have more information, you can go to www.susannamiddermaier.com. The book is called Pragmatic Psychology, Practical Tools for Being Crazy Happy. And it's out on Amazon and other different internet stuff, whatever it's called. I'm not so educated around that part, but anyway, I'm so grateful. Thank you so much, Lauren Polly, for being here and having the courage and the vulnerability to showing us a different possibility. Thank you, thank you, thank you.
Thank you for spearheading a different possibility on the professional side. It's so welcome and so needed. Thank you.
Thank you. Cool. Everybody, see you for another video on this channel. Have a wonderful day and bye-bye.